Hello, everybody. Welcome to this conversation with Lothar Wieler, specialized in microbiology and infectious medicine at the Global Peter Drucker Forum. Very welcome, Lothar Wieler.
Thank you so much, Eduardo, for having me.
You're working intensely at the Hasso Plattner Institut. What are you doing there?
Well, basically, the Hasso Plattner Institute is a leading IT engineering institution in Germany. And in addition to this, it also is an academic faculty at a public university. So this is a unique opportunity, actually, because usually you do not have a privately funded academic institution at a public university. And what we are working on is we have a very interesting ecosystem there. Not only do we have leading specialists in IT business, be it AI or database management or whatever you can think about, or cybersecurity even. But in addition to this, the Hasso Plattner Institute offers a design thinking school and an entrepreneurship school. So basically the students that are taught at this place are really fit for purpose.
It's interesting because you're moving outside of a narrow specialization into other fields. Are you thinking of adding humanities also to that?
Yeah, absolutely. You know, I am the coordinator of the so-called digital health cluster. At the Hasso Plattner Institute, we have formed 5 research clusters, one being digital health. And to be very frank here, it's all about bringing humanity and technology together. And particularly in the health sector, obviously, it is so important that we move ahead digitization, but it's not because of the technology, but because it should serve the human beings. And that's the key issue here.
Tell us more about the research or the projects going on with healthcare and digitalization.
Yeah, so we are currently 5 professorships in this cluster. However, we will grow to 7, perhaps even 8 over the next 2 years. So there in principle are 2 areas where we work in. One area is what we call precision medicine. So basically, you're using large data amounts, for example, to make better diagnostics, better predictive models. I think a key area that people are working in this cluster is, for example, looking at oncological patients, tumor patients. What can you do to more specifically treat this particular cancer? What can you do to more specifically diagnose a certain disease? This is what we call precision medicine on an individual level. But I am interested more in a public health perspective. So we call it precision public health. So my group is more interested in trying to get people to live more healthy. You have to understand that most of the diseases that we are talking about today are diseases that could be prevented. Number 1 and 2 is diabetes and ischemic heart disease. And there also cancer comes into play. However, diabetes, you could prevent 90% if you only live healthy, you do some physical activity, and the food intake is more healthy. So you can prevent this. And bringing people, empower people to live more healthy, digital tools can also do a good job there.
It's interesting because health was concentrated in curing disease, and now it's moving to a more holistic, again, approach of lifestyle. Besides the data collection, what other things can we do to help people improve their lifestyle in terms of nutrition, sleep, and other good behaviors?
Yeah. You absolutely touched the point. So far, first of all, the biggest issue and the biggest hurdle, the health systems in most of the societies, the system as such are rotten because they incentivize that you treat sick patients. Most medical doctors and hospitals make their living from treating sick patients. So the outcome is volume. More patients, more money.
Yeah, the incentives are the other way around.
It should be changed. So this is the big issue here. The first issue, before we can put the best technological tools in there, but as long as the system is rotten, you can't change it. So we have to change it to an outcome oriented system. Outcome means longevity. People have to live longer and more healthy. So having said this, it's of course a huge issue because you have to change the system totally, which is really, really, really not easy to do. But how can you do it from the point of the individuals and the public health sector? Basically, I mean, it's about education. Obviously, education is very, very important. And of course, you can educate people with digital tools. You can multiply it. You can scale it up if it is the right educational tools that you're using. And you should always be able to offer the people incentives to make a better living. They have to understand it. You know, there's this new drug on the market. It's a therapeutic where you can treat obese people. You give them a shot, yes, and they will lose weight. So this is terrible. There are some people who need this drug, but no people. This will be a lifestyle drug because people say, "Oh, I want to get slim," and instead treating the preventive issue, they go into the therapeutic. They should live more healthy and should do more physical activity. Then they don't need this drug, you know?
It's interesting because when you move to living a healthier life, you have a challenge that is not just that you have to explain them, because we know it already.
Exactly.
But it's hard to do it. Why do we have such a hard time to do exercise, to meditate, to have a healthy diet? Why is it hard?
So you have to have an incentive of it, you know? You have to be lucky by what you are doing. And so far, the incentives that are given by the society, by companies, some companies do it actually, or by governmental institutions, the incentives are not that much that people really like their jobs and like the outcome, and they could be really get advantages by having a healthier lifestyle. But it's just about productivity in terms of products they are producing. But you could bring this together if you change the incentivation system. Because if you don't change the setting, the environment, people alone can't do it.
Changing the incentives. Give me one place to start.
Well, imagine you would get incentivized if you do more physical activity and eat more healthy. You, of course, then you, as an employer, you have to offer the opportunity to do it. Okay. Offer the opportunity to do some stuff, and in your canteen, offer good food. And then, if you measure this, you could even say, okay, those people who take this path, you could even incentivize them by the biggest incentivation still, money. It's not great, but it's an incentivation.
It's effective.
It's effective, absolutely, yeah.
Going back to science, what's the role of AI in all these challenges?
AI, from my personal understanding, is a huge game changer. Okay. It has both critical sides and positive sides. I think it has more positive sides. If we know the critical sides, we should mitigate them and handle them. But imagine, for example, when it comes about large data, of course, obviously no medical doctor can ever have that much knowledge in his head than an AI system could do if you have a patient. But also, if you think about scaling up solutions, it's pretty easy to scale it up. And in addition, you can automate a lot. So this really gives you the chance to automate also the so-called patient journey in a hospital, which could be more efficient, not effective only, but really efficient. So the outcome could be more efficient if you utilize it properly.
So enormous amount of data, automation, scaling up, because you could give Africans the best level of service. Yeah. What will be the new role of doctors in this world?
Yeah. I mean, we don't have enough doctors. Okay. So first of all, they can really, in an ideal world, they could stick to their job. Instead of doing bureaucracy, or so, they could take care of the patients. Okay. They could talk to the patients more for a longer time. You know, they could show more empathy. Yes. They would have more time to it, because the other stuff is done by automation, for example. Mm-hmm. So doctors are the key here, because they should utilize, they should be supported by AI. And when you're talking about African countries, for example, one big issue or two big issues with AI are. One is bias. We have a huge problem because currently all the data are trained on from from the global north data. So these are biased because it's different than people in other parts of the world. And secondly, of course, there's the possibility that you have produce an even larger digital divide, so that the division, the partition between the global north and the global south is getting even bigger. So we have to directly think about how can we put these methodologies also to colleagues from all over the world. It's dominated by English language. Think about training models. Most of the training models are in English language, but there are hundreds of languages worldwide. So we have to take all of this into consideration, yeah? Because otherwise, other countries and part of the world will not profit from AI.
You highlighted a few of the problems with AI, like language, digital access, biased data, input data, but are there any other more serious?
Oh, yes.
Share a few.
So basically, we're now talking about unintentional issues, yeah? Because most of the people don't want to widen the gap for digitization. But of course, there are also intentional problems, intentional misinformation. It's a huge issue. If you intentionally, for example, program algorithms towards a certain group of people that drive them into whatever disease, for example, you could do it. And I think, for me personally, the biggest issue is misinformation, calculated misinformation. If you look back to the pandemic, for example, there was definite misinterpretation, misinformation, in particular about vaccination, which did a lot of damage. And this is something that I'm personally most afraid of.
Let's finish with that. What were the lessons learned in handling the global crisis we had with COVID?
Yeah.
You played a key role there. Lessons learned.
Well, I think the biggest lesson for all those who are not in the so-called public health sector is a pandemic is not only a health crisis, but it's a crisis all over the society. So obviously, if you want to solve such a crisis, you have to work together, as we say, all over government. Yeah? Because the government plays a key role when it comes to frameworking, to setting up legal rules and so on. And the second issue here is it's all about trust and communication. Without trust, you don't have any chance to convince people to do the right thing. And so this trust has to be built up in times of peace, because otherwise it's simply too late. These are my most important lessons.
Didn't you find a mismatch between political objectives and healthcare objectives?
I think this mismatch was seen at certain time points, in certain moments, and this is one of the issues that we should really dive into more, because most countries don't do it, but we have to understand it. I have a quote from Mario Monti, the previous Prime Minister of Italy. He said, "We have to be geniusly mistrusted against politicians." Why? They have a problem with time and with space. Time, they want to get re-elected after 4 or 5 years, so they have to solve all the issues in this time, which is not possible. And space, they have, which is a pity, to look at a national level. They can't really think about global issues because the voters won't incentivize them for this. So obviously politicians are in a tough job.
Thank you very much, Lothar Wieler. And thank you for watching Drucker TV.